Hi. Today, let's talk about some of the different ways, technologies, and techniques that we use in plastic surgery to remove fat. So there's two basic paradigms. First, there's liposuction, and then there's non-surgical fat reduction techniques. Liposuction is a procedure in which we utilize suction to remove the subcutaneous tissue, which is the fat, from under the skin. Liposuction is used not only to remove the fat, but also is used for sculpting different areas. So you can utilize liposuction on its own by removing fat in problem areas, but you can also combine liposuction with other procedures such as facelifts, breast reductions, and also body contouring, abdominoplasty, and also you can use it to contour the thighs and the arms as well. Traditionally, liposuction can be performed either in an outpatient setting under general anesthesia, but it also can be performed in an office-based setting without general anesthesia, just depending on how much liposuction in the area that is going to be performed. Liposuction is the gold standard for fat reduction. It's the most predictable way to remove the fat because the surgeon is allowed to directly see the fat removal and see the response of the skin after the fat is removed. Generally, liposuction does require some downtime and some recovery. Now, when you compare that to non-surgical fat reduction technologies, there is the ability to have less downtime and less recovery. So some of the technologies that we use for non-surgical fat reduction are technologies that freeze the fat, technologies that heat the fat, and then enzymes that actually are injected into the fat. These technologies are designed to create a condition within the fat such that the fat dissolves itself. This is a great technique for those who have small problem areas and have good skin tensile strength. The other benefit is that there's less downtime and less recovery compared to liposuction. The problem with non-surgical fat reduction techniques is that it's less predictable than liposuction. Usually with these techniques, you have the procedure and you have to wait several months to see the results. A lot of times you have to repeat these procedures as well. So if you're choosing between surgical and non-surgical liposuction, the question you have to ask yourself is how exact and how direct do you want the fat to be removed and how much control you want over the situation. Another disadvantage of non-surgical liposuction techniques is that you have to rely on the skin quality in order to get the result that you want. So those technologies that freeze fat, warm fat, or dissolve fat with enzymes, they don't address the skin problem as well. Liposuction is better in terms of our ability as surgeons to control the skin. In addition to that, we can add other technologies of skin tightening during the liposuction procedure to get a better result. One of the advantages of undergoing a liposuction procedure is that we can add other technologies to help control the skin. One of the technologies that we use commonly is Renuvion. Renuvion is a plasma technology that uses heat after liposuction to get the skin to snap back so that way you can have a better, more sculpted result. Depending on how much liposuction you have performed, the recovery can be anywhere from 6 weeks to 3 months. After liposuction, it's suggested that you wear a compressive garment. That garment is there to reduce the amount of swelling, and it also helps with the shaping of the result that you're trying to get from liposuction.